I'm Dr. Loganathan. I'm a neurosurgeon. It sounds funny, but when I was 4 years old, somebody bought me a book, and it was the Charlie Brown Encyclopedia of the Human Body. And there was a section on the brain and the nervous system, and it seemed really cool. And so somebody at the time told me, oh, why don't you become a neurosurgeon? And for whatever reason, that stuck with me. And so when people asked me what I wanted to do when I grew up, I would always say that. And eventually, it became clear to me that that's what I wanted to do. It became my goal, and here I am. So neurosurgeons are physicians who treat disorders of the brain, the spine, spinal cord, and various other nerves and sometimes arteries in the body. Most of that care is surgical, but some of it is non-surgical as well. So in any given week, I might operate on somebody's low back, their neck, their brain, and maybe even their carpal tunnel disease. So there's a wide variety of things that we do. I treat patients that have stenosis or tightness around the spinal cord in their neck. I treat patients that have stenosis or slipped discs or herniated discs in their back. I treat patients that have brain tumors. I treat patients that have trigeminal neuralgia or facial pain. I treat patients that have hydrocephalus or water on the brain. I want every patient that I operate on to have no other alternative except surgery. And what that means is I don't think that we should operate on patients who can have some other non-operative form of treatment first. So I like to make sure my patients have made sure that they have no other available options to them, be it medicines or other treatments or physical therapy, before we take them to the operating room. Once we've made that decision that they need an operation, I want to give them the best care that they can receive, but also give them the smallest operation that they need to fix their problem. The most satisfying thing about being a neurosurgeon is that often people come to me with very significant problems that they've tried other ways of fixing, and sometimes life-threatening problems, sometimes problems of pain that's been bothering them for long periods of time, sometimes with weakness in their arms or legs. And it's very satisfying to be able to stop that process, to reverse that process, and give them back the life and mobility that they had prior to developing the problem in the first place. There are two big reasons that I'm so happy I'm here right now. This is a great time to be a new physician or a new patient coming to Allegiance. There's a lot of growth and expansion, especially as it pertains to the field of neurosurgery. Foremost amongst these is Allegiance becoming a trauma center. And in doing so, this hospital system will be able to take care of many patients that in the past had to go somewhere else. But at this point in time, everything's come together to make this the best place to have trauma care in the region. This includes new physicians, new nursing and other hospital staff, and new technologies that make this a really exciting place to come.